Welcome, everyone. We're going to give everyone a couple of seconds to join. Happy to see you all here. And we are recording. Great. All right. So hi, everyone, and welcome to the Inclusive Education and Early Childhood Community of Practice meeting. My name is Stephanie Pena, and I am the Inclusive Education Coordinator for the Global Campaign for Education US. If you are not yet a member of our community of practice, we welcome you to join. We've put the link in the chat, but I'll do it again as well. And please also feel free to introduce yourself in the chat box with your name and your affiliated organization and where you're coming in from. For a couple housekeeping reminders, we have closed captioning available in English. So if you would like to enable your captions, please just click on the CC at the bottom of your Zoom screen to turn on your subtitles. I want to also note that we are recording this meeting and we will be sending out a follow-up email with a link to this recording, along with all of the other materials and resources that will be referenced today. We are really, really excited to have you all here. And we really want to encourage interaction with our participants today as much as possible. So please, we invite you to pose any questions or comments that you have in the chat box, and we'll do our very best to address them throughout the meeting. So with that said, I'm really excited to introduce you to our three incredible speakers. We will begin by having a presentation on USAID's progress on updating their disability policy from Katherine Guernsey. And thank you all for sending in your questions for Katherine in advance. We'll spend some time addressing those questions after her update. And if you have any additional questions, please just feel free to put those in the chat as well, and we'll compile them with our current list. Afterwards, we will welcome two of our new coalition members, EYElliance and AAEEH, and we'll learn about the incredible work that they're doing on inclusive education. So a big welcome to all of our speakers, and it is my pleasure to introduce Katherine Guernsey, who serves as the Disability Rights Coordinator for USAID. Over to you, Katherine.
Hi, everybody. Good morning, good afternoon, good evening from wherever you're joining from. It's a real pleasure to be with you. Thank you for the invitation to come and speak to the group. Always happy to talk about what we're doing at USAID around disability inclusive development and updating our policy. I'm going to keep my initial remarks fairly short. I wanted to give the vast majority of the time. There's a very in-depth set of questions that colleagues had teed up. So I want to make sure that we have plenty of time to try to get through as many of those as possible. And if people have additional questions here, but just to set the stage a little bit, USAID was one of the first bilateral development agencies to adopt a policy committed to disability inclusive development. And that was back in 1997. And that was a really proud moment for us. The world has changed somewhat since 1997, people may have noticed. There's a new treaty, not so new anymore, the Convention on the Rights of Persons with Disabilities. The Sustainable Development Goals, unlike the Millennium Development Goals, actually mention disability. It's a very different context in which we're operating now, and we are long overdue, frankly, to update this policy. I don't know if any of you had the opportunity to tune in to any of the Global Disability Summit presentations. I don't know if you caught our administrator, Samantha Power, gave a presentation there. This was the first time that we have, as the United States, both state and USAID, submitted commitments to the Global Disability Summit. And we were very pleased that the administrator could help to roll those out. But you will have perhaps noted that she referenced that one of the things we're committed to is updating our policy and trying to infuse it with the principles and approach of the CRPD. Now, the United States isn't a party to the CRPD. We've signed, we've not yet ratified, which is a particular pain point for those of us who worked on ratification or been involved in the negotiations of the CRPD. But I live in hopes that someday that may yet change. But whether we're a party or not, that doesn't change the reality that the CRPD has become the lingua franca, if you will, of disability. And the vast majority of countries, all but a very tiny handful of countries where USAID works, they're all either a party to the treaty or have some relationship to the treaty. And so it's a really important document for us, even if the United States isn't yet a party to it, because the countries that we're working with are parties. And so we want to make sure that we are situating our updated policy within this new world, not so new anymore, but new by USAID policy standards. Um, and so in terms of process, we do have a working group internal to USAID. One of the things we thought it was really important to do, though, is before we started putting pen to paper, we wanted to do our due diligence and to uphold the principle of nothing about us without us. So we did engage with some discrete consultations with external stakeholders, and that took place in August of last year, because we wanted to hear from people with disabilities in different countries. We wanted to hear from disabled people's organizations, or OPDs as they're also known. We wanted to hear from non-DPO disability organizations and any organization that is engaged in disability inclusive development. We obviously didn't speak to everybody, we couldn't, but we wanted to get a good cross-section. We also included some self-advocates and some folks in academia. So we really wanted to make sure that we had some broad engagement to inform our approach. And that was really helpful for a couple of reasons. One, we wanted to hear from people. We wanted to learn what their expectations are. And we wanted to also get a sense of how people view the policy. And I think one of the things I wanted to say today briefly was, between policies, strategies, and vision documents, policies are the highest of the three types of documents at USAID. But what a policy really does, the power of a policy for us, is that it helps to create the environment and the framework, the policy framework, into which we can then develop more technical guidance documents that are specific to certain issue areas. And it can also help us to move forward with any necessary updating of our automated directive system, the ADS, to use bureaucratic language. It's sort of like our rules and regs, if you will, for our agency. And that's the thing that makes actions mandatory. And so what we're trying to do with the policy alone can't in and of itself mandate certain things, but it can set the tone, it can set the stage. And then with that framework, we can move forward with, with updating our ADS as necessary. And we know that there's things that we can do better. Data disaggregation, for example. Our ADS requires data disaggregation on the basis of sex. It doesn't actually list other factors for disaggregation. So, there's a number of points of opportunity that we, within the structures and the other parts of the architecture of USAID, with a strong policy in place that's really infused with the principles of the CRPD and true inclusion, we can leverage that then to proceed with implementation through making other changes across the various components of USAID that may be necessary to really make things, or I like to say, we want to bake disability into everything that we do. So that's some top level sort of overarching remarks. Next steps, we want to, we're working on a draft. People keep saying when. My hope was to get everything done by the end of the year, but there's a war on in Ukraine, you may have noticed, and it's been really challenging to both be responsive to these very real world crises of the pandemic and this war and other situations of conflict and crisis, whilst also trying to manage this in a meaningful way and not give it short shrift, frankly. I would rather take a little bit of extra time and do it right than rush something and live with it and regret that. We want to do right by the disability community as we engage in this. So I ask for forgiveness if it does take us a little bit longer than we might like at times, but we really want to come up with something that's quality and that people will be proud of and that will really truly inform us. So there will be a public draft made available that anybody in the world, it'll sit on our public-facing website, anybody in the world will have the opportunity to review that, give us their feedback, and I hope everybody here will be interested in doing that. We want to hear from a diverse cross-section of people who are active in the disability and development space. So once that's available, we can certainly let folks know, but it will be on our public-facing website. We'll take all of those comments on board and do our best to reconcile where we can. And then we'll move forward with a final version for release. So that's a little bit of a sense of the process. I want to pause here. I'm assuming that this is a good opportunity to cross over to the questions that colleagues had submitted.
Yeah.
Should I just go through them in order? Is that the easiest thing, or does somebody want to facilitate?
Yeah, I can ask if that's easier. You kind of addressed our first question. Our first question was really how can we, as members of the community of practice, really help in this process, and what would be helpful from us as advocates for inclusive education. So it sounds like you will be able to share with us when that draft is available, and we can essentially consolidate our feedback for you, or how is the feedback process? How would that work?
So typically, we provide a copy of the policy, and then there'll be a web-based form that allows people to identify this page or this section. This is our feedback. It's up to you how much you wish to consolidate or not. On the one hand, it's easier for us to go through, one comment versus 100, but I also appreciate that getting some consensus around feedback can be challenging for folks. So we leave it entirely up to you all what is meaningful for you in terms of how you want to organize your feedback. Really, we leave that up to you, but we welcome your feedback when it comes.
Absolutely. And we love giving input for USAID, and we really appreciate you guys and everything that you do. I see we have a hand raised, so I'm going to send it over to you, Emily, if you want to come in for a specific question.
Thank you, Stephanie. A very simple question, but I think a very important one. At this time, UNICEF is also completing its disability policy. And since it deals with children, I think it's a particularly interesting one to look at in relation to your own. Have you worked at all with the UNICEF person involved in leading this effort, who is Natalia Muffel, M-U-F-E-L?
So I have not been involved in the development of that, but I am part of the, and I'm going to get the name wrong, but there's a sort of advisory working group that
wonderful.
just recently, where they rolled out the sort of quote unquote final DPAS, D-I-P-A-S, I think they're calling it. And so I've had a chance to sort of look through, not in the level of depth as I would like, but we did give a little bit of feedback on that version. And I have to say, there are some pieces in there that I'm excited about, only because there are some elements in there that we haven't necessarily seen in other policies, but are elements that we ourselves were looking at and wondering, gosh, are we going to be the first to be talking about issues of ableism, for example?
Right.
And to see that encapsulated in the UNICEF policy, hoping that will be in the final draft of that as well. That was really exciting and helped confirm for us that some of the approaches that we're considering and trying to reflect in the document. And I say all this knowing that it will need to go through many clearances before you all get to see it.
I know.
To say that we are grappling with, framing of issues and making sure that we're being forward leaning on these things. I feel like in the disability space, there's often a lot of things that go unsaid, and issues of systemic ableism are things that we all know exist, and we don't necessarily talk about in formal policy documents as much as they deserve. So we're trying to grapple with some of these concepts and figure out how can we amplify appropriately those concepts and respond to them, and have that feed into our overall approach. So I was very excited to see that, and we will be taking a closer look at UNICEF's policy to help it inform what we're doing as well.
Wonderful. I think at the same time, it would be really great if you could share the USAID drafts, even early drafts with them, because since it's a collaborative process and we're all concerned about the same ultimate goals, I think that the process could be very enriching for both agencies. And there are other agencies, of course, watching what is occurring.
So yes, I appreciate what you're saying. I will say part of the issue with sharing draft text is complicated by the fact that our ADS that I referred to earlier has very strict procedures for how we share text.
Right.
And so most likely the first opportunity we will have to share text with anybody, we will share it with everybody. It's not something that we can roll out with specific interlocutors or stakeholders. We have to release it publicly to everybody. So UNICEF will of course be welcome to give us feedback just as anybody, and look forward to that. But yeah, I apologize that we're a little bit bound by our requirements for how policy is developed and updated at USAID, the certain procedures we have to follow, which don't always align with quite how one might like to do it. But I absolutely appreciate what you're saying, and welcome. If you're speaking with colleagues at UNICEF, once this comes out, ping your colleagues and encourage them to respond as well. Thank you.
I shall with pleasure. Thank you.
Thank you for that question, Emily. And also feel free to raise your hand. And I see Don also has a comment in the chat. He's asking, are you seeing any opportunities for baking in emergent progress with the disability policy in the complex programming for children on the move from Ukraine and encountering USAID initiatives?
So Don, great to have you here, and thank you. Don was one of the folks who was kind enough to spend some time in our early consultations, so appreciate that. We're certainly trying to be mindful of what we are seeing happening in the real world right now, in terms of where things are working and where things are frankly not working. We're having ongoing conversations with our Bureau for Humanitarian Assistance, BHA colleagues, who do participate on the working group for disability policy updating, and who did come up with commitments for the Global Disability Summit. So we are really trying to make sure that all of those stakeholders within USAID are also brought in, so that we can be, again, setting a policy framework that will work regardless of portfolio at USAID. It shouldn't matter what anybody's working on. We want this policy to resonate with and inform how they're doing things. The baking in piece tends to happen more at that ADS level, right? So again, you might not see in the policy something as specific as specific guidance in humanitarian assistance versus education versus something else. But what we hope to do is create, I think you referred to having a GPS, and trying to remember what the analogy was that you used, but making sure that we're providing people with the compass and the GPS, so that as they're developing that onwards guidance, that they are being mindful of this and the expectations that the disability policy establishes. But yeah, we know that we need to do better. And in some cases in humanitarian assistance, it's somewhat less on the policy side. It's the accountability side, right? So, we've got some great processes in place to ensure, for example, that those who are submitting emergency applications to assist in a time of crisis, that those applications are being responsive to a wide variety of inclusion issues, including disability. Where it gets more challenging is then once they're funded and out doing the work, in that very fluid situation of a crisis, how are we making sure that the folks are accountable to what they said they would do in their application? And so that's an ongoing area, and an ongoing area that deserves the specificity of technical guidance. So Don, I'm not sure I'm responding very well to your question, but I hope we can at least sort of, we're trying to incorporate this knowledge and learning and these situations where we know there are gaps, and create something that will provide a firm foundation to move forward with filling those gaps in the future.
Yeah. Keep up the good work. Thank you so much.
Great, thank you for that. So it actually kind of touches on one of our other questions about what policies will you use to ensure that disability inclusion in education within emergency settings in the policy. Is that going to be a component within the policy update?
So again, this is a great example of a very, very specific
Yeah.
context, right? And I know, in fact, I think I saw somebody's name on here who is in our education center. We have fantastic colleagues working on disability inclusive education and working to infuse disability and concepts of universal design for learning across all of our education work. And that's actually one of our Global Disability Summit commitments that came from our Center for Education, and they're working really hard to make that a reality. So again, what we're trying to do is, the policy is very high level document. We're trying to make sure that it's creating both the GPS or foundation or whatever analogy we want to use, so that colleagues who will then be developing that more technical guidance have a very clear North Star, to throw in another analogy, so that we are ensuring that that technical guidance will be consistent with this overarching approach that we want to take, and overarching approaches of centering and situating persons with disabilities and their representative organizations as not just folks to consult with, but really driving our development work, right? And not in a way that sort of puts the work on them in an inappropriate way, but really centers them, so that we're doing work with the community and not for people, and that we're responsive to their feedback on things when we don't do it right. But it's really important that some of these very specific issues be addressed in technical guidance documents, because the technical guidance documents can be updated in a much more fluid and frequent way than a policy can.
Right.
So we don't want to end up, and you may see in the old policy, there's some references to some very specific things that don't exist anymore. And so we don't want to put ourselves in a situation where we do something thinking this is the latest, greatest thing, and then, you know, we learn how to do it better, but we've stuck ourselves in a situation where, that's not now current. So when it comes to very specific issues, we want to make sure that that's the subject matter of technical guidance documents, but the policy informs all of that. And I know our education colleagues are absolutely working. I think they have a toolkit on helping colleagues to be responsive in situations of crisis, to ensure that learning can continue and it's quality learning and it's inclusive of learners with disabilities. So as always, education is ahead of the game. Our Center for Education folks are leading the way.
Yes, and doing incredible work. A couple more questions for the sake of time. I'm going to kind of bundle them together. Are there any contract mechanisms dedicated specifically to awards for DPOs? And what does USAID do to increase people with disability staff at the agency? And then a follow-up question as well, in terms of how will like universal design or human-centered design, inclusive design be prioritized in this policy?
All right, so we'll work backwards. So concepts of universal design are clearly really important, not just in the learning space, but across what we do. We're actually sort of having an ongoing debate at the moment. We're working in our principles section, operating principles, and there's another section that will address sort of how to operationalize all of this, how you carry out these things in a manner that is consistent with those principles. And there are some things that we're debating, does it fit as a principle or does it fit more as an operational approach? And a concept like universal design is something that we're sort of playing around with to figure out where it fits, and maybe it's actually referenced in different ways in a number of different places. So be assured, universal design as a concept will probably end up somewhere in here. Exactly how and where is still, we're working on that. Colleagues with disabilities, employees with disabilities at the agency, we have got to do better on this. Our statistics are not where we want them to be. The federal government as a whole has a target of 12%. And I forget the percentage of colleagues with targeted disabilities, but we're not there yet, and we need to be. We also have to be responsive to the fact that USAID has many different hiring mechanisms. Those statistics tend to relate to foreign service and civil service. I'm neither, and there's a whole bunch of other people who work at USAID who are neither. So how do we make sure that we're capturing that portion of the workforce as well? I know our reasonable accommodations division are continuing to bolster their approaches to make sure that we are creating or making available the tools that colleagues may need to be able to work fully if they need reasonable accommodations and that sort of thing. So we're working on this from a number of different perspectives, but diversity, equity, inclusion, and accessibility is definitely a conversation that's very hot right now. And so please rest assured that inclusion of employees with disabilities is definitely part of that DEIA conversation. And then I think the last one was contract mechanisms, right? So yes, so the funding that I work with actually doesn't work through a mechanism in the sense that it's being used in that question. Our funding goes out in an annual competition to USAID missions that we publicize because we want the disability community to be aware that USAID missions have this opportunity. And we frankly want to create an opportunity for those groups to be able to knock on the door of a mission. If they don't have a relationship with them, knock on the door and say, hey, did you know you guys can apply for funding? We have great ideas to share. And even if the mission isn't going to apply, hopefully that's a catalyst for starting a conversation and a relationship. So that's what we do with our congressional mandate. There are other colleagues who have funding that relates to disability that is moved through different contract mechanisms. And we continue to examine ways that we, in Inclusive Development Hub, where I sit, what are mechanisms that we could utilize that could be inclusive, but probably not exclusive to disability, that could be inclusive of, for example, small grants funding to help disabled people's organizations who aren't in a position to be primes on USAID funding, which I wouldn't want to be a prime. There's a lot of paperwork involved in that. So, what are mechanisms we can be using to ensure that we can provide appropriate supports to DPOs, OPDs, and do so in a way that's accessible to them and would be meaningful support. So those are ongoing conversations. And if I'm misunderstanding the question, or if there's something else that folks had in mind, feel free to chat me. I know we're getting short on time, and I don't want to overstay my welcome. So I'm happy to address that.
Thank you so much. Yeah, this is we really appreciate you coming and speaking with us. And I do see that Evelyn's asked a question in the chat. So if it would be possible for Katherine, if you could just respond in the chat so we can be cognizant of time, that was really great. Thank you so much. At this time, I'm going to pass it over to my colleague, Krista, who will be introducing one of our new coalition members. Over to you, Krista.
Thank you. And I hope you're seeing my screen well as well. Yes?
Yes, you're good.
Thank you. My name is Krista Giesecke, and I serve as Inclusive Education Policy Officer with the Global Campaign for Education US. I'm very privileged to have the opportunity to work with our 80 different coalition members who are committed to promoting the right to quality, inclusive education for all. And we welcome ongoing coalition membership applications. I think Stephanie will put my email address in the chat box. So if you're interested in joining the Global Campaign for Education US Coalition and more actively taking part on some of these consultative processes and being involved in our regular meetings, we would love to have you. Today, I'm pleased to introduce Liz Smith, who's the co-founder and chief executive of EYElliance. Wonderful work that they do. As someone who has needed eye correction since childhood, I've often thought about what my life would be like and what my opportunities would be like if I didn't have that. So excited to hear about your work, Liz, and over to you.
Great. Well, thank you so much. I'm really excited to be here today. And more than anything, to learn from all of you. We've been doing our best to get smarter about the inclusive education space, but we know we have a really long way to go. So really feel privileged to be joining this group and be a part of this conversation today. And I'm not sure if Nafisa is on the call, but I just wanted to say how grateful I am to her for making the introduction to GCE. So I will keep it as brief as I can. I'm assuming you all can see that.
Not yet. Let us know.
Oh, okay.
I'm happy
Let's
to.
see. No, this is, it's, let's see, sorry.
That's okay. Take your time.
Here we go. Is that
Perfect.
That's
all right?
Thank you.
Great. So EYElliance is a coalition organization as well, and our mission is to accelerate equitable access to eyeglasses for the 950 million people who are visually impaired, and that vision impairment could be corrected just with a pair of eyeglasses. And I'm not sure if you all are aware, but in 2019, the WHO released a world report on vision. And in that report, they concluded that those who are living with vision impairment because they cannot access treatment, whether that be cataract surgery or a pair of eyeglasses, that the WHO has set forth in that report that they should be considered to have a disability. And interestingly, around that same time, the World Bank also released a report that focused on school eye health, which is what I'm going to be primarily talking about today. But in that report, they concluded that addressing vision impairment in children, particularly in primary school, can play an important role in the World Bank's commitment that all of their programs should be disability inclusive by 2025. So just wanted to share that context with you all if you didn't already have it. As you can imagine, uncorrected vision impairment has profound impact on learning outcomes. It also affects road safety, the access to digital economy via mobile applications. And we also have research that's shown that a pair of reading glasses can increase productivity by as much as 30%, which has been really eye-opening, no pun intended. EYElliance was founded in 2015. We are exclusively focused on the global and national strategies that are needed to solve this problem. We are working to support the creation of routine, reliable access to eyeglasses where people live and learn. So today, not surprisingly, I want to focus on the potential for improved learning outcomes when vision impairment is addressed. So here are some key data points, but I think the thing to note on this slide is that the number of students affected by myopia, already a large number, but it's on the rise. And this is due to a lack of exposure to sunlight when children's eyes are in their development phase. And this is relatively new understanding of why myopia develops. But as children spend less and less time outside and more time, in cities and indoors, the rates of myopia are on the rise. And so we're trying to keep pace with that as a community. And here's some data points from that 2019 report that the World Bank published. And the one I think is most interesting to point out is the correlation between uncorrected vision impairment and lower completion rates of primary school. And I think that's just so compelling when you think about what a relatively simple intervention it is to provide eyeglasses to students who need them, and then of course increase the rates of completing primary school. So there's been a fair amount of studies done on the impact of providing eyeglasses to children with vision impairment in schools. One of the more interesting ones is that that particularly in primary schools, by providing eyeglasses to children with vision impairment, you can improve test scores, which I think is really tangible, concrete evidence, right, that this is improving learning outcomes. Also, that the intervention of providing vision screenings and glasses provision in schools is both affordable and cost effective. So that's, that was been really great to get those data points. But many of you might know this, but for those who are not familiar, school-based vision screenings and the provision of eyeglasses is what we call school eye health. And it basically involves training teachers or nurses to provide basic vision screenings to the children in their schools. And so this is very straightforward process. Essentially what the teachers are doing, they'll have a chart on the wall, but essentially what they're doing is triaging and understanding which children have good eyesight, don't need to be seen by a doctor, have healthy eyes, and then those who need to be seen by an eye doctor. And so it's quite a straightforward process for those teachers, and takes about 2 minutes to screen each, or between 2 and 5 minutes to screen each child. So it's not time consuming. Once those children are identified who need to be seen by the eye doctor, an eye doctor will come to the school and give those children a comprehensive eye exam right there on the spot. And if they are in need of a pair of eyeglasses, they are able to provide them within minutes of that exam due to a relatively new technology in the last few years where you can pop in lenses into a frame, and that innovation in those glasses, they're called ready to clips. They can address 86% of all children who need a pair of eyeglasses. And so the vast majority of kids can just get those glasses right there on the spot the same day as all the other children and students getting their glasses. This process, these exams also sometimes surface children who need to have more advanced care. And so a key part of this work is to be establishing the appropriate referral systems so that those children then are referred to the appropriate facility for the treatment they'll need. I think what's also really important to note is that this is not a new intervention. NGOs have pioneered this work really, decades ago at this point, and over the years, gotten really smart about what's working and what's not, and released in 2016 a set of guidelines that sets forth best practices. What is newer when thinking about school eye health is that governments, there's relatively new interest from governments to be integrating this work into all of their systems. So from soup to nuts, from training on to eventually procurement. As you can imagine, this requires collaboration between ministries of health and education. And there's certainly been strong collaboration with eye care NGOs and the Ministry of Health when doing this work over many, many years. But what we're seeing now, and what EYElliance is really interested in learning more about, is, like I said, this interest to really fully integrate into existing systems. And obviously that creates efficiencies and more in long-term sustainability. As you can see, some of this work began back in 2012 in Cambodia. This was, as far as we're aware, was the first time that a government had really integrated school eye health into their national education sector plan. That began as a collaboration and a partnership between GPE, Sightsavers, the Partnership for Child Development, the World Bank, and the Fred Hallows Foundation. And so that was, really where a lot of this government-led focus originated. In Liberia, EYElliance has been working there with other partners who've been there for many, many years. In 2018, the Ministry of Education released their first school health policy ever, and EYElliance, along with our colleagues at Sightsavers, really worked to ensure that school eye health was included in that first school health policy. And so that was a really exciting moment in time. We've also been supporting the expansion of school eye health in Liberia alongside Sightsavers and other partners. And again, the focus has really been on ministry-led, with both the Ministry of Health and Education really leading and driving the effort. We've really seen tremendous results in Liberia. But in terms of the support that we, EYElliance and other eye care NGOs provide in country, it's, as you can imagine, a focus on capacity building. And given the very small number of eye doctors in country, there's also a parallel workforce development and training plan as well that we're all working to advance in country. And perhaps the most exciting thing from my perspective is that Liberia, the Ministry of Education, is in the process of, I don't want to say finalizing, but they're advancing, I guess, their next national, their next education sector plan. And at this time, we're really thrilled that school eye health is in that next sector plan, and it's part of an integrated school health program approach that the Ministry of Education is putting forth. And the other thing that's been really interesting to see from the work in Liberia is that the Ministry of Education is pushing for that teacher training that I described earlier. They're really trying to understand if they can integrate that training into all the training that teachers receive prior to the school year starting. And I think it's, I think it's at least 1 or 2 days of training. And so they're looking to move that and really systematize that training and add it into the work that's done before the school year starts. And I'll just wrap up here and just say that, what EYElliance has been trying to learn more about is, what it will take to integrate this work, school eye health, this proven intervention, what it will take to integrate it fully into government systems. And also in particular, we're looking both at a national and level in Liberia, but also globally to understand how children who are living with vision impairment, correctable with eyeglasses, how that will really fit into the broader inclusive education movement. And again, that's really where I'm looking to learn from all of you. So thanks and appreciate the time.
Great, thank you so much, Liz. I see a comment in the chat from our colleague Suzanne, who says, we'd love to see this vision screening brought to 3 to 5-year-old population so that children do not miss out on these learning opportunities at this really critical time. I'm just wondering, kind of going off of that comment, is there work that you're doing specifically, or is there any future work that you will be doing on early childhood development or early childhood education?
That's a great comment. We have been very much trying to connect with early childhood development groups. One thing just to bear in mind is that most vision problems develop in children starting at age 6. And so in terms of catching the most children, being able to triage at the point where we're able to identify the most children, it really does start in primary school. But we're always interested in making those linkages because, as you say, there will be children that could benefit from that in a real profound way. And
Absolutely.
so, yeah, so we do have those conversations.
Great. There's another, I'm going to go over to you in a second, Bob, but there's one other question from Sophia in the chat that says she'd like to know more about the ready to clip, the glasses that you had referenced, and to know how affordable they are, and just a little bit more context would be helpful.
Yeah. I'm excited to answer that question. They are very affordable, and I'm not going to give you an exact number, but they, in terms of the difference between customized glasses, I can share as a reference point. There's a research study done, analyzing the savings, but essentially, I think they're in the range of, I want to say $4 to $7 wholesale. It may actually be much less. So it is comparatively to customized glasses much more affordable. But in addition to that, there is a donation opportunity that is being provided by the world's largest manufacturer of lenses and optical shops. They're called EssilorLuxottica, and they are providing donations to governments and NGOs looking to use those pop-in lenses. They're called ready to clips. And so while they are very affordable, there's also an opportunity to receive a donation. And just to give you a sense of the size of the donation, it's over 100 million pairs. So wow. It's quite substantive. So there's not really an issue in terms of that donation being limited. However, there are, of course, questions to consider around sustainability, and ensuring that programs aren't dependent on a donation, but just to give you a sense of the opportunities.
Great, thank you. Bob, if you'd like to come in, I see your hands raised if you'd like to ask your question.
Yes, thank you so much. And can you hear me?
Yes.
Yes, thank you so much, Liz, for sharing. I saw that you are also working in East Africa, but what I wanted to know whether you're already in our country, Uganda. And secondly, I want to ask, which age are you starting from to give those services? Because here in Uganda, we have different ages whereby they would like to get your services. Maybe if we could allow Rights for Disability Development Foundation to partner with you, we welcome that opportunity. So which age do you starting from, and do you work in Uganda?
The intervention around school eye health starts in primary school. But as I mentioned, I think there are opportunities to be connecting with early childhood development. And I probably should have made this clear at the top, but EYElliance is, we work through and with partners. So we operate globally and in certain countries at national level, providing support to the ministries and other eye care NGOs as needed. So while we EYElliance are not in Uganda, I'm well aware of some really terrific work that is being done still by some of our eye care NGO partners. And I certainly can connect you. The other thing to say is that I think Uganda is one of the next countries where there's a lot of momentum and tremendous opportunity around school eye health. And particularly, I think there's the timing of the GPE planning process is I think I think it's, you would know better than me, but that I think there's some good points of convergence in Uganda. And there's been so much incredible work done by the government already. And so we are not there. We do have partners there that I can connect you with. But I also think that's going to change. I think there is going to be a movement in the next year or so to really focus in Uganda.
Okay, that's great. We shall welcome it.
Great.
Thank you.
Thank you for that. Thank you for that question, Bob. For the sake of time, is it okay if Liz, would you mind answering any of the questions directly in the chat? And if you want to share your contact information as well, we also really encourage that. I'm going to send it over to Krista to introduce us to our next coalition member presentation.
Thank you so much, Stephanie, and thank you for this fascinating presentation. We're so delighted to have another new coalition member in Association d'aide à l'éducation d'enfants handicapés, so association to help children with disabilities with education. And Ernestine NGO MELHA is here on this call as the executive director to present on their work. Here is her introductory bio, and if Ernestine, if you're ready, I'll just go to the main slide.
Good morning, good afternoon, everyone. Thank you for giving me the opportunity to introduce our organization and our work. In Africa, most children with disability do not have access to education. Those who attend school are less likely to complete their schooling. Next slide, please. It is the reason why we have created the Association d'aide à l'éducation de l'enfant handicapé in 1998. Next. So in 1998, we founded the association in Cameroon. The primary aim of the association was to promote the human rights of people with disabilities, and in particular, the right to quality education for all through awareness raising. At that time, we were talking about education for all, and it was a very an international movement, and it was a great opportunity for us to raise awareness concerning education, the right to education for children with disability. In 2012, in France, we extended our activities at international level and in Europe level. So we continue doing our awareness, And we also had another area of intervention concerning human aids and development. In 2013, we had the status of the UN ECOSOC, and we had a large audience, and we had to work with other organizations to amplify our advocacy and our awareness. Our vision in our organization is to work for a world where all children with disabilities have access to quality education, remain in school system until the end of a cycle of study, and acquire the qualifications and skills necessary for their employment. To do so, we have 4 missions: promote the right to education for children with disabilities, contribute to the achievement of inclusive, quality, and equitable education for all, promote the empowerment of people with disabilities, and especially girls with disability through education and training, and contribute or conduct research in the field of education and disability. So our activities are oriented in 3. Next slide, please. We are working in Cameroon, France, Benin, Burundi, Democratic Republic of Congo until now, and we have focal points in the United States of America. Next, please. Our activities are oriented in 4 directions. As I was probably saying, we do a lot of awareness raising and advocacy for the education for children with disability, to ensure that the issue of disability receives support, and we try to integrate disability into development policies and programs, and establish strategic partnership to strengthen our advocacy. The other thing we do is to explore potential areas of collaboration and partner with like-minded organizations, and then we develop a partnership with other organizations abroad. We also provide multi-facet support for the education of children with disability and girls in particular. For instance, we accompany and support students or their families in various administrative procedures, or we help them to get in touch with other professionals who can help for the education of the children. And we also mediate between education system and authorities, local authorities or community, in order to make sure that everybody is involved in the process of education of children with disability. The other area of our activities is research. We conduct research in our organization at small scale in order to support our advocacy, and in order to have real in-depth of the reality of schooling of children with disabilities. Next, please. So, for instance, we have some projects. In 2020, for instance, we had a cycle of conferences on gender, disability, and education. And the aim of the project was to contribute to improving the perception of disability, changing mentalities and attitudes in connection with SDG 4 and 5 and disability. In line with that project, we we conduct another one in 2021, which was in the continuity of the results of the conference we conducted in 2020, and the project was Notre Voix, or Our Voice, and the aim was to break the taboos, prejudice, and stereotype, and give voice and amplify voice of girls and women with disability in order to inspire other people. And the project is continuing in one short line. It is about health and sexual reproductive health and rights for young disabled. And last year we have had an activity regarding the hygiene menstruation, and we did assessment on what is going with girls with disability about on that area. So we are continuing this year with that project, and we are continuing doing awareness, and we are also in line with the Generational Equality Forum, which was held last year, to see how we can connect with that agenda. The other project we are conducting is health and school monitoring of disabled children, and the project's objectives are to provide support for children with disabilities attending school through the distribution of school supplies, payment of school fees, payment of breakfast, and healthcare and sensitization of parents of children with disability, and educational actors of the care of children with disabilities. The last project is raising awareness of parents for the education of children with disabilities. Those projects are implemented in various countries where we have partnered with other organizations. For instance, we are doing the project concerning girls with disability and hygiene menstruation in DR Congo and Cameroon. Next, please. So in 2020, during the pandemic, we have conducted an assessment on continuity or learning with or for people with disabilities, and we have produced a document, and the document has been published this year in 2022. In regard with the Generational Equality Forum, which was held last year, we also conducted a survey which bring out to a publication which is what bring the voices of girls with disabilities to the Generational Equality Forum, priorities and recommendations. And now, as I was saying, we are working on the initiative which is named we want to provide girls with disability with sanitary pads, hygiene products, menstrual hygiene, and disability hygiene products regarding girls with disabilities. And the initiative is named Dignity Kids Initiative for Adolescent Girls with Disabilities. We have shared the concept note and some elements of that project with some members of the community of practice. So it is what I wanted to share with you concerning our organization and what we do. And I am listening and aware to reply or to give more information about concerning what I have said. Next, please. So we can find out in on our website is there. We can contact us and maybe join us or follow us on Twitter. Thank you very much for your kind attention.
Thank you so much for joining us and for that great presentation, Ernestine. If there's any questions, I'd like to open the floor for maybe 1 or 2 questions if anyone has one. Over to you, Bob. Bob, I see your hands raised. Did you have a question that you'd like to ask?
Can you hear me?
Yes.
Yeah. I want to thank the presenter. What she has presented sounds very great and good work. Unfortunately, we, as our country, we didn't hear that they are already in our country. But when do they plan to come in our country so that maybe be able to benefit from their services? That's my question. When do they plan to come in Uganda?
Thank you, Bob, for your question. Maybe you can email us and then we will discuss how we can partner.
Okay.
Great. Yes,
Okay.
I put Ernestine's contact information in the chat that you can use as well. Thank you, Bob. I see another hand raised. Is that Cleus? I'm sorry if I'm mispronouncing your name, but please feel free to come off of mute and ask your question.
Yes, my name is Sundon Cletus from Ghana. I would like to know if their organization has worked on anything on getting pregnant girls and teenage mothers back to school, because when you look at issues, this is a very topical issues when you come to Ghana. And my organization, Africa Education Watch, in partnership with Star Ghana, I've worked on a couple of worked with a couple of institutions, especially pre-tertiary institutions, to look at ways and means in which we can support pregnant girls and teenage mothers back to school. So if the organization is actually looking into doing something in this way in the West African region, my organization is always ready to welcome them and then to partner with them. Thank you.
Thank you for your interest of our work. On our we are not working on return to school for pregnant girls, but we are working on preventing pregnancy among girls with disability, because sometimes it seems like girls with disabilities are denied of the right of sexual activity, if I can say it like that. So our aim is to make sure that girls with disability are also considered in aspect of sexual health and reproductive rights health. So we don't work on return to school, but we work on preventing pregnancy. But we can continue the conversation. You have my contact. Maybe we can have some ideas.
Thank you so much, Ernestine, and thank you for coming and speaking with us today. We really appreciate it and all the work that you're doing. Before we close, we wanted to open up the floor and let you know about some of the upcoming events that we have. And also, if anyone has any events that they would like to share, please feel free to unmute yourself or put those events in the chat so that we can share those out with our networks as well. We're really excited to announce that ActionAid, Light for the World, and Global Campaign for Education is officially launching their manual on gender responsive, disability inclusive education sector budgeting. It's basically a toolkit that can be used, and that launch will be on May 25th at 8 a.m. Eastern Time. Thank you, Jennifer, for putting the link to register for that event, for that launch. If anybody else has anything or any upcoming events or anything that you would like to share, please feel free to jump in now. or share it in the chat. Otherwise, we'd really just want to thank you all for joining us today. And again, this recording and all of the relevant resources and materials will be sent out to you soon. Our next meeting, a little save the date, is going to be on July 20th at 9 a.m. Eastern Standard Time. And we're hoping to discuss inclusive teacher education training. So if you would like to present, or if you have a suggestion for presentation, please feel free to reach out to me directly. We really, really love when you guys send your input and suggestions. So thank you all, and we will see you soon.
Thank you too.
Thank you, everybody. Kudos to Stephanie and everyone for bringing this conversation together. Huge thanks to all of the speakers. Katherine, we look forward to next steps with USAID and are stand ready to assist. Thanks, everyone. Have a wonderful weekend.
Thank you very much.
Thank you too.
Thank you all. Good